It looks as though the rate of increase in new infections of the COVID-19 virus is continuing to slow. That also means more days are passing before the number doubles, which is exactly what you need to see if we're getting this pandemic under control.
A Qantas flight from Sydney to Adelaide has been turned around mid-air after 6 baggage
We heard
handlers
yesterday
at
that a
Adelaide
cluster of Qantas baggage handlers at Adelaide Airport has tested positive for the COVID-19 virus. It led the South Australian Chief Public Health Officer to offer some advice to travellers.
So if you have come off a flight today or in the last 24 hours, it may be worth giving your bags a wipe over.
That raises a question a lot of you keep asking. How long does the virus last on surfaces? A recent study published in the New England Journal of Medicine showed it differs depending on the surface.
So the literature shows that the virus is viable for quite a long time, up to about 72 hours on stainless steel and plastic surfaces, much less time on porous materials such as cloth, paper, and cardboard. For cardboard, the laboratory research suggests that it can be viable for up to about 12 hours. It does degrade fairly rapidly on all surfaces over time.
The other question this study sought to answer is how long the virus hangs around in the air.
The study really tried to simulate environmental conditions and aerosolize the virus so that the droplets would then be sprayed in the air. And it appeared that the virus would float in the air for anywhere up to about 3 hours under some conditions. The most common route of transmission is directly from person to person.
And so what should we do about supermarket shopping and sending packages in the mail to elderly parents?
The virus is actually quite delicate in the environment, and it's cased in lipid, and that lipid is easily destroyed by any detergent compound, alcohol, bleach, many substances. There's actually quite a number of things that will inactivate it. Many food experts will suggest that just a good thorough rinsing with water is what you need to do with your produce. But certainly once you come back from the grocery store and unpack your goods, make sure to wash your hands thoroughly.
So the takeaways from this? Keep your distance from other people because that's how you'll most likely catch the COVID-19 virus. Clean surfaces well with whatever you have to hand, whether it be detergent, alcohol, bleach or peroxide. A comfort package for your elderly parents or grandparents is going to do far more good than the tiny risk of harm. And keep washing those hands. And just on that, we've had several inquiries about whether people with skin conditions such as dermatitis and eczema are safe to use soap-free hand wash. Is it as effective as soap? And the answer is yes, go for your life. It's all about the surfactants, chemicals which act like detergents but can be gentler on your skin than soap. An enormous and looming concern is what will happen in Aboriginal and Torres Strait Islander communities if COVID-19 gets into them.
It's scary in a sense because of my condition, high blood pressure and diabetes and etc. So I guess I'm concerned in that sense. Has the health system organised and going to be able to support the communities as quickly as possible if there was a possibility of a coronavirus outbreak within the communities?
Dr Mark Wenitong is a health advisor for the Apinipima Cape York Health Council.
A response to remote communities, particularly around having enough resource and infrastructure to respond to this kind of a pandemic, is really limited currently, and we do need more help.
Can you give us a sense of the fragility of communities and why communities are so vulnerable?
Aboriginal communities are generally small in population. They live in crowded accommodation. In a house that I was recently involved in a problem, there were 27 people living in one house in a remote community. So these communities will act like cruise ships once we get the introduction of the virus. There'll be high rates of infection.
The issue with vulnerabilities, I think, is particularly around having lots and lots of people who have chronic diseases such as type 2 diabetes, hypertension, cardiovascular disease, etc., and then them being not well controlled some of the time.
We're going to need buildings. We're going to need safe transport for people to those buildings. We're going to need accommodation, food, toilets, showers and security. I think that unless we get the ADF, then it'll be incredibly hard to organise quarantine locations, safe transport of people and rapid transportation both of swabs as well as people who need to be evacuated.
With the elders in our communities, they're one of the most important parts of our communities. I've been in situations, in massive kind of bad situations where elders have come in, all they had to do was be there, and it provided confidence and this backdrop of solid kind of rock behind our communities, and it stopped people worrying and being anxious. So without them, there's a real loss for us.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.